Hey guys, this is Stacy back at Easy Acupuncture School, Part 3, Patient Interaction, Part 3. Thanks for joining me. Stacy Hewitt, acupuncturist, 13 years, teacher 7, and we're going to continue our journey on how to interact with your patients. So let me get my screen going here, and boom. Where last time we left off with our adventurers. Let's see, it was about going back into the room. Current slide. There we go. Current slide. Re-entering the room. Like I said, gently knock because you've already told your patient that before you come back in, you're going to knock just so you don't catch them off guard. So tap, tap, tap. Let them know you're coming in. You'll come back in and they'll be naked and on top of the sheet on the wrong side. It's like not everybody, but once in a blue moon, you'll come in and there's somebody laying naked on top of your table. It's naked as the day they were born, and you just go, well, you decide to yourself, and all you do is say, hey, this is no big deal. Um, it's no big deal. So just say, oh, I need you to get face down if they're face up and they're supposed to be face down, um, or vice versa. And then I say, and go ahead and get under the sheet so you don't get cold while I'm working on you. Because a lot of times when people get relaxed, they start getting chilly. So just get underneath the sheet and keep you covered up and keep you warm. And then I'm going to just step out of the room for a second. And then I'm going to come back in and let you get situated. And we're going to start. And most people don't have problems with that. Most people don't. I mean, I've never had problems with anybody getting underneath the sheet. So don't worry about, if they start to give you grief about it. The only time I've ever had problems, I've had problems twice in 25 years, or yeah, 25 years. And they were both when I first started out doing massage. I wasn't even doing acupuncture then. Because I had one person that was from another country and they were confused about why I was going to step out and why they needed to get underneath the sheet. And because they were from another country and they were like from Germany or something, and they were like, in Germany, we don't have to do this. And I'm like, well, it's a little different here. If anybody ever, put you in that situation, just say, well, you still need to get under the sheet and you make something up. You say, like in North Carolina, state laws require that if you're undressed, you need to be underneath the sheet the whole time. Just make something up to make it easy. Don't get in an argument with them about, you need to get underneath that sheet. You're, not respecting my boundaries. Just say, North Carolina, it's required that you have to be underneath the sheet if you're not dressed. And she was like, "Oh, okay," and everything was cool. And then another time, this is when I was doing massage. I was uh being a substitute therapist for one that was out of town, and there was this guy that was being a real weirdo and about. Well, this person's my last massage therapist, and I get completely naked, and they lay and I don't have to get underneath the sheet, and I'm like, yeah, I hear you, but you're with a different person right now, and North Carolina law requires or says that you need to be underneath the sheet. So if they weren't putting you underneath the sheet, I don't know what to tell you, but I'm just going to follow the books. So I'll let you get underneath the sheet. And there you have it. And like I said, you don't have to argue with people about, you know, the moon is aligned in a certain place where in order for me to get as much energy as I can, I've got to be without a sheet on. Well, North Carolina law requires that you need to be underneath the sheet. And I'm just following the books. And I think I've got a window right here and the moon's not even out. So, but I think you'll get enough energy through here. Just make something up so it's not confrontational. But just also, if a lot of times I just gave you two examples. That's two examples out of 25 years. That's all I've ever had problems with. So very rarely are you ever going to come up with people that are, very obstinate about trying to get underneath the sheet. Most of the time, if people aren't underneath the sheet, it's because they've made a mistake or they're confused. Just casually instruct them what they need to do, and they'll do it. So it's nothing to worry about. Nothing to worry about. Let's see here. Boom. There we go. Treatment time. I love this picture. Eddie's 1 second acupuncture treatment. He's throwing all the needles at you at one time. But anyway, so it's time to treat them. So the very first and most important thing is explain everything you're going to do, especially if it's their first time, and especially before you do it. Because people are nervous. We've talked about this 1,000 times during this lecture, but people are nervous. And if you let them know what's going to happen to them, they're more comfortable and your treatment's going to work better. It's going to work better. Explain, explain, because when you don't explain, then you're going to come back in and the person is like sweating like crazy. And it's not because they've got some kind of lung qi deficiency. It's because they're nervous because they don't know what's going on. So I just explained. I mean, not every person's going to come back. You're going to come back in. That's just an example. Not every person is going to be sweating when you come back in. But I'm just giving you an example. I was just thinking about when I very first started out, and this isn't even acupuncture. This is when I was doing massage, and I used to do this chair massage service and I'd go to different places. And I remember working on this director of a retirement facility because I used to do a lot of senior work with when I was doing massage. And I was working with her and she was sweating bullets because A, she had never had a massage before. I was just doing chair massage and she was clothed. She just never had a chair massage. And then B, she was a really wound up type person. And her body was starting to relax and her body just wasn't used to being relaxed like that and just getting into a parasympathetic state, so her body was just discharging. It's like I'm not used to this frequency of being relaxed, so it kind of puts the body under stress sometimes, and she was sweating bullets. But the problem is I was too young and too early in my career to understand that if I really probably explained to her about the whole, your body's having sometimes it's when we're switching from sympathetic to parasympathetic and our body's not used to being in that rest and digest system, then it kind of makes our body a little stressed out with the transition. And you can see some things like that, but I didn't, I was 20 something. I didn't have any clue. So, but anyway, like I said, explain to them what you're going to do. And if anything strange starts happening, just explain to them why. Because it's not like they're going to be, when I say strange, I'm not talking about if they start levitating on the table. But if they start having a response like I was just telling you about, like that lady that was sweating a lot. Um, just explain to them in a very calm, casual way. Just explain, and just you being calm makes them calm. Always make sure they know what you are doing and why, so they're not nervous. Like I was just talking about this in the last episode, where somebody comes in with a hand pain, and the acupuncturist is starting to do like stretches with them with their legs and rubbing oil on their back. And the person was like, "Well, they didn't really do much on my hand. Did all the stuff that they do was appropriate? Were they trying to cop a feel or something when they're stretching my legs all around and massaging my thighs and things?" Explain if that's part of your technique. Explain to them why you're doing it if it's not obvious. Okay? Because once again, if they're nervous about what you're doing, their chi is going to scatter. You're trying to consolidate the chi to strengthen it. It's going to scatter, and your treatment's not going to be effective. And don't be like, "I'm the professional and you are going to take the treatment that I'm giving you." You know, if you're like a gua sha master and, everybody has to have gua sha or they're not going to get better, If somebody didn't want gua sha, don't be like, I'm the gua sha master. I am going to gua sha you. You know, don't gua sha. Come up with something, be able to adapt and overcome. I I keep for some reason I'm having all these references to when I was and doing massage full time, but a lot of these come from an inexperienced massage person. When I was inexperienced and young, it was like when I first started doing massage, I was introduced to this. I worked with this chiropractor, and I didn't know my head from the hole in the ground. And the chiropractor introduced me to this other massage therapist that worked there that was from Austria or something. And he's like, this is blah blah blah, and most he is the best massage therapist in North Carolina. And I'm young and I'm dumb enough to believe him. And as I worked there, sometimes that guy would go on vacation and I would substitute for him. And I would have people come in and they would say, yeah, every time he works on me, I cry. And I thought they were talking about having a remote emotional release or something like that. And they were like, no, I cry because his pressure is so hard, it's painful. And I'm like, and even when I was a young kid, I was like, that's not right. And then I had to explain to them about the scale from 1 to 10. We just talked about that, with pressure needing to be between a 2 and a 7 to be therapeutically effective. And if it's above that, then it's not being effective. And if it's super above that all the time, then you're really just being abused. And uh, you don't, um, you need to speak up for yourself because that's too much pressure. But all of them are like that. So it's like, and that guy was like, "Oh, well, my technique," and I'm using an accent like he had. I'm sorry, sometimes I do stuff like that. But he's like, my technique is, I am the master and I know what I'm doing. So if I'm pressing on them so hard it hurts, then they just need to take it. No, thanks. That's not what it's about. In the same way with acupuncture or cupping or gua sha, it's like always make sure what you're doing is comfortable. I know there's some techniques out there where you're using needles like that big around and you're plunging them all the way through someone's muscles. If you're doing that, make sure it's comfortable for them. Because if not, then you want to get them to a parasympathetic shift. And if you're using a needle that big around and going all the way through their calf, well, you know, congratulations. But for whatever technique you're doing, but more than likely you're going to put their system into a sympathetic state. And we want to get them to a parasympathetic state. So that's where the healing really happens. So anyway, like I said, if somebody's scared, like yeah, and say you're not using a needle this big around and you're plunging it all the way through their leg, say you're just going to use a point, a regular point, and it's not going to really even be that deep. But if you have a patient come in and they say, I had a bad experience with that point, or that point scares me, or that makes me really nervous, or I had what last time I had that point, I had this emotional release and I wasn't comfortable with that, or yada yada yada. Adapt and overcome. Don't use that point. Even if you're like, I've got to use this point. There are hundreds of points on a person's body, and you can find another point that will have a close enough reaction. So don't be like, I'm the professional. I know what I'm doing. I mean, sometimes you have to, be like, I know what I'm talking about, but don't force a treatment on somebody because once again, you're going to scatter their chi and it's not going to be effective or no, it probably won't be effective, or if it is, it's not going to be as effective as if you had done a treatment that the patient was comfortable with. Okay, here's this kind of goes into what I was just talking about. During the treatment, make a mental note if any needles were hard for them. Sometimes you will have a patient that's kind of a touch me not where you really have to work selectively with them or gently with them because every needle you put in is like, oh my gosh, they're like, that's horrible. And it's like the needle's not even in yet. But And not a lot of patients are like that, but occasionally you get one. But say if you just have a patient that has a normal needle tolerance, and then you come across one that's uncomfortable for them, just make a mental note. If a needle is uncomfortable, I always say, sometimes you feel them go in, that's okay. And if you feel them and they're uncomfortable for you, let's give it a couple of seconds, usually 2 to 3 seconds, and then I'm going to check back with you and say, how's that point? If it's still bothering you, then we'll just move it, or I can take it out and put it back in. But or if the person's like screaming, "Oh my God, that's the worst needle ever, take it out," then I don't give it 2 seconds. I just go ahead and take it out and then try to replace it. Put it in, just re-needle it, tap it back in, and because sometimes everybody wants to pretend that it doesn't happen, like they're the master of acupuncture, and they never hit the wrong place, never hit a vein, or maybe sometimes hit a nerve. Um, it happens occasionally. So always be mindful of that. But the whole point of this is if you do have a point that's hard for them, make a mental note. And then next time you see them, and if you do that point and it's hard for them again, then really think about, um, is there a way to alter the treatment to have the same effect but using a different point? If liver 3 is bad for you, then what about liver 8, liver 14, liver 6? Um, so there's other points, or you can just do it, it could be that it's just that point on that one side. So say liver 3 on the left side for some reason is sore always. You can still do it on the right, and maybe do, depending on what's going on, like I said, liver 8, liver 14. There's other points to use. So don't get too tied up on one thing, one point. Oh, you know what? Before I forget, I'm going to kind of jump stream here because I wanted to show you some draping techniques real quick. I'm not going to get on my table and lay all around. So I'm going to just kind of show you a couple of things that are helpful. So one thing, get this out. Here we go. So say you've got somebody on the table and you need to expose their upper body. And it's a female. So you really need to maybe get to some abdominal points or uh, and they have a top sheet on. So you're like, how am I going to do this? So what you do is I'm going to pull this down for a little bit. You're going to take a pillowcase like so, fold it over. You're going to put it over their upper half and say, hey, I'm gonna keep your upper half covered. I'm going to hold on to this. And then you're going to take the sheet that's underneath that's covering them up, and you say, I'm going to pull that sheet down. And you pull that sheet down, keeping them covered with this pillowcase. But that allows them to stay covered up top, but you're able to pull the sheet down that's underneath so you can get access to their abdomen. If you're trying to get the CV17, you can keep them covered up. You just say, hey, I've got a point here that's going to be right on your sternum. I just need to count the side of your rib cage, or the where your ribs meet your sternum. So I'm going to pull this down a little bit. I mean, don't pull the whole thing down, but you're just going to count. And you say, okay, here it is, and then you put the needle in, and then you can kind of cover them up, or you can kind of cover it up in a V shape, so it's covering their breast, but the needle's not touching the sheet. But sometimes you can just get the sheet and just cover it back up. But if you do, just check with them to make sure that feels okay to them. You don't want them to the whole time be worried about the sheet touching that needle. The other thing I was going to show you, oh, hold on, let me get this sheet here. So sometimes you want to do the conception vessel, right? Or you want to do the Renmine, and you got them, but they got to be covered up because they don't have any clothes on. So one of the things I do or I tell people is if it's in that situation, it's like especially if I'm doing like the Rin Mai, or Chung Mai, and I've got to do a lot of points on the midline. I joke with them and say, hey, look, I'm going to give you what's called the Hollywood drape. And they're like, what does that mean? It's like, you know how like when you see all those women on the red carpet, they have all those dresses and they're cut way down to their navel, so everything's taped in and not coming out. So I'm going to give you the same thing. I'm going to give you a sheet. You're going to put it over the back of your neck and you're going to put it over the front. So you're covering both of your breast up, but it gets me access to the midline. And that's the Hollywood drape. So you're covered up safely, and then I can get access to the gold mine. So that's the thing. And then they're like when I say it's a Hollywood drape, it's like all the women on the red carpet in Hollywood, and people chuckle. They go, oh, but they get it. But so anyway, there's two ways to drape people, so it's comfortable for you and comfortable for them. You can get to the point you need to get to, and it's good. So, like I said, remember any points that are hard for the patient. If they're hard for you, go back and practice on yourself. I spent many a years, and I still do acupuncture on myself, but many of years in time doing acupuncture on myself to practice to get better. And so let's look at the next slide here. Um, okay, and then this is a good we're going to get back to this. I've got a patient that unfortunately is calling me, so I need to find out what's going on with that. So let me take that call, and then I'm going to start this back again. Sorry, guys. Pause. Maybe I can just pause it. Let's see. Option. Well, let's risk it. Thanks for this thing. Pause.